China's COVID outbreak of 2022 has become a major economic and humanitarian crisis. City after city is going into lockdown. The world's second biggest economy is increasingly paralyzed. China's dictator, Xi Jinping, refuses to change his hardline zero-COVID policy. This policy is more about brutal social control and state repression than science. Over 300 million people in China now live in cities in full or partial lockdown. The capital, Beijing, is also under partial lockdown. Hundreds of housing estates and millions of Beijingers are in full lockdown. Xi Jinping says China has the best COVID policy in the world, but this policy relies on a massive police state, sweeping censorship, and zero democratic rights. Shanghai, with a population of 28 million, has been in a full lockdown since the end of March. When the Omicron variant first began to spread in Shanghai, its government said a full lockdown was unthinkable. When things got worse, they announced a two-stage lockdown, half the city at a time. It was to last for just 7 days. 6 weeks later, the lockdown continues. In May, Xi Jinping and the Politburo Standing Committee gave stern orders that zero-COVID policy must be implemented even more forcefully. Despite a downward trend of infections in Shanghai, the local government intensifies the lockdown. The dictator's orders trump science and logic. In lockdown, most people are confined to their own apartment and are not allowed to go out, not even to buy food. Shortage of food, medication, and other necessities are widespread. If one person tests positive, all the residents on the same floor of that apartment building are sent to the quarantine center. Often, the entire apartment block is sent to the quarantine center for a single positive test result. Everyone fears being sent to the quarantine centers, which are in a very bad condition. Some of these centers are described as worse than prisons. Prisoners know when they will be released. This policy is brutal, but also wasteful and costly. Xi Jinping's zero-COVID means vital resources and personnel are diverted away from the healthcare system into mass testing and running the quarantine centers. China's testing companies are the biggest winners. Several of the largest coronavirus testing companies reported a growth in year-on-year profits of between 60 to 190% in April. More than a tenth of China's top 100 billionaires are from the pharmaceutical and healthcare sector. They have had a very profitable pandemic. China's vaccination program has not succeeded amongst the most vulnerable demographic, the elderly. Almost 100 million over 60s are not fully vaccinated. The zero-COVID policy and mass lockdowns are actually making this problem worse. Vaccination of the elderly has slowed in China by half since the start of the Shanghai lockdown. This is because overstretched public health care resources have been diverted from the vaccinating the old and frail into mass testing of millions of people. For workers, the situation is very bad. Not going to work means no money. Many workers in the service, construction, and transport sectors are losing their jobs. Laid-off workers are forced to live on their savings. In lockdown cities like Shanghai, the migrant workers are completely neglected. They don't have a city hukou permit, so they don't count. Some migrant workers who have tested positive have been forced out of the city because officials want to reduce the infection statistics. Migrant workers are sleeping in roads, under bridges, or in ATM booths because they became homeless due to lockdown. A group of 20 construction workers were trapped on a construction site without water, electricity, or bedding for a week. They use water from a fire hydro to cook instant noodles. Workers in China are not allowed to set up a union. Strikes are illegal and in many cases are dealt with brutally. Xi Jinping's dictatorship is also using the zero-COVID policy as a pretext to bolster its social control mechanisms and the powers of the police state. Some local governments have ordered residents to surrender their house keys and lock them inside their homes. In Shanghai, as the lockdown is intensified, police and enforcers go house to house to spray disinfectant in every room and take people away to the quarantine centers. They break the door down if necessary. Social media is awash with videos of protests and injustice committed by the police and enforcers. China's COVID death toll is very low compared to global levels, but there are many deaths as a result of being refused medical attention during lockdown. Hospitals are at breaking point as staff get sick or are diverted to work long shifts on testing stations. Hospital workers in Shanghai have protested and, in some cases, engaged in strikes and sit-down protests against the inhuman conditions. Hospital staff at Shanghai's #2 rehabilitation hospital complained they were made to work even when they tested positive for COVID. Tens of thousands of students in Shanghai have been locked in the dormitory for over a month. Workers have been locked down inside their factories to continue production. It's a so-called closed loop. This has caused clashes and even riots. Every night, pots and pans are banged from windows and balconies around Shanghai. Social media posts, which are quickly swapped, are more critical against the central government, not only the local officials as in the past. The rule of the so-called Communist Party, CCP, is being undermined at a time when Xi Jinping is desperate for stability. The zero-COVID policy has also pushed the economy into recession. It is accelerating decoupling as foreign companies pull out of China. Former China bulls are pessimistic. One leading Chinese capitalist said that the economy is in its worst shape for 30 years. In May, the WHO criticized China's zero-COVID policy as unsustainable. The WHO statement was completely banned inside China. Chinese scientists, including some of the country's most prominent virologists, have also urged a change of policy. Their views have also been ruthlessly censored. To question the zero-COVID policy is to question Xi Jinping's rule. That isn't allowed. Today, the CCP is further inciting nationalism, the foreign threats, and need for national unity as a means to control society. It is extremely unlikely Xi Jinping will abandon the zero-COVID policy, especially before the Communist Party's 20th Congress at the end of this year. At the Congress, Xi wants to consolidate his one-man dictatorship by rubber-stamping an unprecedented third term. The build-up of tensions is preparing explosive events in China. Solidarity against repression in China and Hong Kong stands on the side of China's workers, young people, and oppressed minorities. The pandemic cannot fought effectively by capitalist governments, whether authoritarian or democratic. Xi's regime says opposing his zero-COVID lines means to do nothing or lie flat. That's not how socialists see it. An effective fight against the pandemic needs strong independent workers' organizations and full democratic rights. Vaccinations needs to be stepped up, especially for the elderly through a mass awareness campaign, and reversing the import ban on mRNA vaccines, which have a much higher efficacy against COVID-19. Emergency restrictions should be decided democratically and organized by democratic grassroots committees. Universal unemployment and medical insurance are needed as part of the creation of a decent welfare system for all workers. The discriminatory who code system must be abolished. China's healthcare system needs massive investment and upgrading. It needs powerful independent trade unions of healthcare workers and democratic working class control. Socialist measures to take over the wealth of the capitalists are needed to plan the economy democratically. And all this requires an end to dictatorship for a fully democratic working class-led society.